A biotech breakthrough to report today. 40 million Americans suffer from migraines and chronic headaches. 80% of those are women. BIOHAVEN is one of the companies on the case. Joining us now is Jill Dehlin, a board member for the National Headache Foundation. What can you tell us about the latest medicines or preventative treatments?
That is the tricky part because some medications will work for some people. So it's a lot of trial and error for us with migraine as we try different medications. There are new medications out there right now that are created specifically for the migraine attack. The other drugs that were prescribed for migraine prior to this were borrowed from other disease states. But more than 2/3 of the people in our study with migraine who have tried a preventive feel as though they're chasing an unreachable goal. But most of us feel as though we still have hope that there's going to be a treatment out there that will work for us.
You are representing BIOHAVEN. What's that company working on right now?
BIOHAVEN has a medication called Nurtec, which is for migraine attacks. It's an acute medication used to treat a migraine when it's happening. And there is research being done by BIOHAVEN to possibly use this drug on a more regular basis as a preventive.
For employees who suffer from migraines, what is that like?
I'm glad you asked that question because employers can do a lot to help their employees with migraine disease. Many people who have migraine feel as though they're being stigmatized by their coworkers or even sometimes by their employers. So employees should work with their employers and vice versa to reduce the triggers that people experience at the workplace. For example, bright lights, onerous odors in the workplace, loud noises. And because all of those things can trigger a migraine attack, people with migraine want to do the work. We want to be productive, and having a migraine attack may temporarily take us out of the game. But boy, when we're productive, we're really productive because we're really never sure when the next migraine attack is going to come. It's a very unpredictable disease.
Good to have all of this information. Thanks so much for coming on our show.
I appreciate it. Thank you.
Check us out on social media. We're on Facebook, YouTube, and Twitter. And go to businessfirstam.com for where to see our show on TV.